These are the clinicals related to anatomy of the lungs. This is the clinical injury to cervical pleura and apex of lungs. First, the extent of pleura. Because of inferior slope of first pair of ribs, the cervical pleura and apex of lungs project through superior aperture into the neck. This is the superior aperture and this is the pleura of the lungs, and the apex, this is the apex, and pleura extend into the neck. Consequently, lungs and pleural sac may be injured in wounds to the base of the neck, resulting in severe problems. Injury to lungs. The injury to lungs result in various severe respiratory problems. These are the problems due to injury to the pleura of the lungs. First is hemothorax, hydrothorax, pneumothorax, hemopneumothorax, and emphysema. And these are being discussed in the next slides. The concept of pleural cavity. प्लूरल कैविटी की कंसेप्ट को समझने के लिए सबसे पहले लंग्स की कवरिंग पेराइटल प्लूरा एंड विसरल प्लूरल कैविटी इसको देखते हैं. द आउटर कवरिंग ऑफ द लंग इज कॉल्ड पेराइटल प्लूरा एंड इट इज डिराइव्ड फ्रॉम सोमैटोप्लूरिक मेसोडर्म ड्यूरिंग embryonic period. And visceral pleura, a covering of lung inner to the parietal pleura is called visceral pleura, and it is derived from splanchnopluric mesoderm during embryonic period. Pleural cavity. The cavity between parietal pleura and visceral pleura is called pleural cavity. Now, pneumothorax. Entry of air in the pleural cavity is called pneumothorax. Pneumo means air, and it results from a penetrating wound of the parietal pleura, or from a bullet, or from a rupture of pulmonary lesion into the pleural cavity, which results in the collapse of the lung. And this is the lung which is collapsed, and here it is the injury to pleura. Now, hemothorax. Hem means blood. Entry of blood into the pleural cavity is called hemothorax. And what are the causes of hemothorax? By a chest wound, hemothorax results more commonly from injury to a major intercostal or internal thoracic vessel than from laceration of a lung. This is pleura, and it is the presence of blood in the pleural cavity, and it is hemothorax. Hemo means blood. Hydrothorax. Hydro means fluid. Accumulation of significant amount of fluid in the pleural cavity is called hydrothorax. What are the causes? Hydrothorax may result from pleural effusion, escape of fluid into the pleural cavity. And this is the pleural cavity, and when the fluid enter into the pleural cavity, it is called hydrothorax. Hemopneumothorax. Hem means fluid, which is mainly blood. Pneumo means air. Accumulation of fluid and air in the pleural cavity is called hemopneumothorax. What is its evidence? If both air and fluid accumulate in the pleural cavity, an air fluid level or interface sharp line horizontal regardless of patient's position, indicating the upper surface of the fluid, will be seen on a radiograph, which is a chest radiograph. What is emphysema? Accumulation of pus in the pleural cavity is called emphysema. What are the causes? Infection of alveolar sacs, and then the rupture of these sacs causes entry of pus into the pleural cavity. Thoracentesis. What is its procedure? It is a procedure to insert a hypodermic needle through an intercostal space into the pleural cavity to obtain a sample of fluid or to remove blood or pus. This is the needle which is being inserted into the pleural cavity, and these are the layers of the muscle which are being pierced by the needle. Site of needle entrance. To avoid damage to the intercostal nerve and vessel, the needle is inserted superior to the rib. And this is the rib, and the needle is inserted superior to the rib. Superior to the rib, high enough to avoid the collateral branches. Important points during thoracentesis. Inserting the needle into the ninth intercostal space in the mid-axillary line during expiration will avoid the inferior border of the lung. और जब नीडल को इंसर्ट किया जाता है थ्रू द नाइन्थ इंटरकॉस्टल स्पेस और रिब के सुपीरियर बॉर्डर से भी सुपीरियर इसको इंसर्ट किया जाता है. The layers which are penetrated. These are the layers of the muscles which are being pierced by the needle. और इनकी तरतीब कुछ इस तरह से है. फर्स्ट स्किन, सुपरफिशियल फेशा, डीप फेशा, external intercostal muscle, internal intercostal muscle, innermost intercostal muscle, then parietal pleura, and then the needle gains entry into the pleural cavity. First here must lies the skin, then superficial fascia, deep fascia, and external intercostal muscle. This is internal intercostal muscle, and this is the innermost intercostal muscle. And to avoid injury to the vessels and intercostal nerve, the needle must be inserted superior to the rib, and then the needle gains entry into the pleural cavity. Pleurectomy. The surgical removal of a part of pleura is called pleurectomy. Pleurodesis. In some procedures, adherence of parietal and visceral layers of the pleura is induced by covering the opposing layers of pleura with an irritating powder or sclerosing agent. This is called pleurodesis. Significance. प्ल्यूरेक्टमी और प्ल्यूरोडिसिस की सिग्निफिकेंस क्या है, अब इसको देखते हैं. सिग्निफिकेंस ऑफ प्ल्यूरेक्टमी एंड प्ल्यूरोडिसिस. Pleurectomy and pleurodesis are performed to prevent recurring spontaneous secondary atelectasis. Atelectasis, spontaneous lung collapse, caused by chronic pneumothorax or malignant effusion resulting from lung disease. And it is the procedure of pleurectomy. This is the monitor to show the excision of pleura. This is the forceps being entered into the pleural cavity through the intercostal space. Thoracoscopy. Thoracoscopy is a diagnostic and sometimes the therapeutic procedure in which the pleural cavity is examined with a thoracoscope. Small incisions are made into the pleural cavity via 1 to 3 intercostal spaces. In addition to observation, biopsies can be taken. Pathological formations can be excised, drainage can be established, and some thoracic condition can be treated. Pleuritis. Itis means inflammation. Inflammation of the pleura is called pleuritis or pleurisy. Pleurisy makes the lung surfaces rough. The resulting friction, pleural rub, is detectable with a stethoscope. और प्ल्यूराइसी का जो एविडेंस है उसकी साउंड जो कि सुनाई देती है स्टेथोस्कोप से. इट साउंड्स लाइक अ clump of hairs being rolled between the fingers. Pleural adhesion. The inflamed surfaces of the pleura may also cause the parietal and visceral layers of the pleura to adhere. This is called pleural adhesion. और इसमें प्ल्यूराइसी में या प्ल्यूराइटिस में विसरल लेयर और पैराइटल लेयर ऑफ प्ल्यूरा एडहेयर हो जाती हैं. Acute pleuritis. Acute pleuritis is marked by sharp stabbing pain, especially on exertion, such as climbing stairs, when the rate and depth of respiration may be increased even slightly. Acute pleuritis में होता ये है कि शार्प और स्टैबिंग पेन होता है, स्पेशली हार्ड वर्क के दौरान, ड्यूरिंग क्लाइंबिंग स्टेयर क्लाइंब करने के दौरान, और जब रेट और डेप्थ ऑफ रिस्पायरेशन इंक्रीज हो जाता है. सेगमेंटल एटिलेक्टेसिस. The blockage of a segmental bronchus by an aspirated object will prevent air from reaching the bronchopulmonary segment which it supplies. Air moves to the blood. इसमें होता यह है कि जो ब्रोंकोपल्मोनरी सेगमेंट तक एयर पहुंच नहीं पाती, and then air moves to the blood. The air in the blocked segment will gradually be absorbed into the blood and the segment will collapse. और जो सेगमेंट की एयर है वो मूव कर जाएगी ब्लड में और सेगमेंट कोलैप्स कर जाएगा. मेंटेनेंस ऑफ सेगमेंट वॉल्यूम. अब जो सेगमेंट कोलैप्स कर गया है इसके वॉल्यूम को कैसे मेंटेन किया जाए? इनिशियली the volume loss may cause a mediastinal shift to the side of atelectasis, but the ipsilateral segment may expand to compensate for the reduced volume of collapsed segment. अब ipsilateral segment जो कोलैप्स कर चुका है वो एक्सपेंड होगा और एक्सपेंड करके वो कंपनसेशन कर जाएगा जो वॉल्यूम रिड्यूस्ड हो गया कोलैप्स सेगमेंट का, और इधर मीडियास्टिनल शिफ्ट हो जाएगी वॉल्यूम की. हेमोप्टाइसिस. स्पिटिंग ऑफ ब्लड और ब्लड स्टेन्ड स्पुटम डिराइव्ड फ्रॉम द लंग्स एंड और ब्रोंकियल ट्री इज ड्यू टू ब्रोंकियल और पल्मोनरी हेमरेज. ब्रोंकियल आर्टरी या ब्रोंकियल वेसल वेन्स, अगर इनका हेमरेज हो जाए तो ब्लड या ब्लड स्टेन रेस्पिरेटरी पैसेजवे में आ जाएगा. चांस. इन अबाउट 90% ऑफ केसेस द ब्लीडिंग इज फ्रॉम ब्रांचेस ऑफ द ब्रोंकियल आर्टरीज. 95% केसेस में ब्रोंकियल आर्टरीज के हेमरेज से हेमोप्टाइसिस हो सकती है. Causes. The most common causes include bronchitis, inflammation of the bronchi, lung cancer, pneumonia, bronchiectasis, pulmonary embolism and tuberculosis. Pleural pain. अब इसमें जो है प्लूरा, विसरल प्लूरा और पेराइटल प्लूरा का पेन डिस्कस किया जा रहा है. विसरल प्लूरा. Visceral pleura is insensitive to pain because it receives no nerves of general sensation. Parietal pleura, outer layer of the lung. अब इसके जो पार्ट्स हैं वो हैं कोस्टल प्लूरा, सेंट्रल पार्ट ऑफ पेराइटल प्लूरा, सेगमेंट और डायफ्राग्मेटिक प्लूरा. फर्स्ट है कोस्टल प्लूरा. The parietal pleura is extremely sensitive to pain because of rich nerve supply. अब parietal pleura का costal part. The costal part of parietal pleura is richly supplied by branches of intercostal and phrenic nerves. Irritation of parietal pleura may produce local pain or referred pain projected to dermatomes supplied by same spinal ganglia and segments of the spinal cord. Costal and diaphragmatic pleura. And this is the costal and diaphragmatic part of parietal pleura. Irritation of costal and peripheral parts of diaphragmatic pleura results in local pain and referred pain to the dermatomes of the thoracic and abdominal valves. जो इरिटेशन है कॉस्टल और पेरिफेरल पार्ट डायफ्राग्मेटिक प्लूरा की, अगर ये इरिटेशन हो तो ये लोकल पेन और रेफर्ड पेन के रिजल्ट की सूरत में जाहिर होती है, और ये पेन डर्माटोम्स, थोरेसिक और एब्डोमिनल वॉल के डर्माटोम पर पेन अपीयर होता है। मीडियास्टिनल एंड सेंट्रल डायफ्राग्मेटिक part of parietal pleura. Irritation of mediastinal and central diaphragmatic areas of parietal pleura results in referred pain to the root of the neck and over the shoulder C3 to C5 dermatomes. अब फ्री नेक नर्व जो सप्लाई कर रही है पेराइटल प्लेरा के मीडियास्टिनल और सेंट्रल डायफ्राग्मेटिक प्लेरा को, और ये सप्लाई कर रही है C3 टू C5 नर्व्स। अब जो C3 C5 डर्माटोम सप्लाई कर रहा है शोल्डर को भी और निक के डर्माटोम को भी। अब जो इरिटेशन होगी मीडियास्टिनल और सेंट्रल डायफ्राग्मेटिक एरिया ऑफ पेराइटल प्लेरा को, तो ये पेन रेफर्ड हो जाएगा टुवर्ड द रूट ऑफ द नेक एंड ओवर द शोल्डर। दिस वाज द लास्ट क्लिनिकल ऑफ anatomy of respiratory system.